Hello, it's Dr. Elisha Van Dusen with New Hope Chiropractic. Have you ever had foot pain? Do you have foot pain? Well, chances are very likely that at some point you have. Foot pain is such a common problem that 75% of all Americans will experience it at some point in their lives. And with 26 bones in each foot, it's easy to understand why this can happen. Each foot also has nerves that send messages to the brain, telling it the precise location of your body. This is called proprioception, and it's really necessary for the brain to coordinate the feet and other parts of the body to make the desired motion. Also, the feet bear the impact of somebody's entire body weight striking the pavement or flooring thousands of times every day. And this can easily result in damage to the bones, nerves, muscles, tendons, and ligaments that can cause significant pain. Also, if your shoes don't fit well and you have diseases like diabetes, this can produce problems too. While foot pain is not always preventable, good news is that chiropractic care can make it short-lived. Treatment typically consists here of chiropractic adjustments, orthotic shoe inserts, and exercises. Also, some muscle therapy can help as well. So most people have either experienced or heard about plantar fasciitis, and people with this ailment experience pain in the heel due to a strain in the ligaments that support the arches of the foot. And this condition is named for the plantar fascia, which is a band of tissues that connects the bones and the toes to the heel bone, and it also supports the arch of the foot. You can have ligament strains, typically cause pain here too. They also cause swelling and inflammation. Now, traditionally medical doctors, allopathic doctors often prescribe medication or give cortisone shots to patients that have this condition. However, chiropractors take a natural approach to pain management. So this may include adjusting your posture, teaching people to balance their weight equally between feet, and also specific at-home exercises. Also, people may find the fastest, most effective relief by working with both a podiatrist and a chiropractor. Some of the other foot ailments that we can help with chiropractically as chiropractors can be Achilles tendonitis. This occurs after engaging in physical activity without stretching first, and chiropractor will typically have patients do specific stretching exercises to counteract the pain. Also, ankle sprains can be more serious than they appear at first because they affect the muscles, tendons, and bone. As the ankle heals, the talus bone may not return to its proper position. So chiropractically, we can adjust the talus bone to improve the healing. And we'll also advise patients to follow the standard Rice method, which stands for rest, ice, compression, and elevation. Also, arthritis is another thing that can cause problems with your feet. Although chiropractic can't cure arthritis, we can adjust the toes, foot, and ankle to reduce joint swelling, and that decreases the inflammation and helps prevent further damage. Also, if you have bunions, this is another way in which your feet can cause you pain eventually. Poorly fitting shoes can cause the big toe to move too close to the other toes, and this results in a bunion. And we can, as chiropractors, help to reduce the extreme pain and inflammation by adjusting and then mobilizing the joints there and preventing inflammation and pain from getting worse. Also, if a person has flat feet and you notice an arch in your foot that's lacking or very, very shallow, when you stand up, the entire foot hits the floor or the inside of a shoe, and this condition is typically present in childhood, although injuries and normal aging can make it even worse. So chiropractor can adjust the area and prescribe exercises that allow the arch to increase naturally. So these are all ways chiropractic can help. If you have foot pain or you know somebody who does, check us out at newhopechiropractic.com, and we can go ahead and set up an appointment for you to get you some relief. And with that, happy walking and have a healthy day.